we're going to place this in the sulcus and we're going to work kind of slow, and actually what we're trying to do is displace or open the sulcus a little bit, and sometimes some material will come out ahead of it. That's okay. I want to push that into the sulcus there and make sure it stays. Hopefully we can see that there. All right, we want to keep that relatively dry. I'm pushing this in the sulcus atraumatically, and I'm leaving it on the tooth right there. Same thing. You see what I'm doing? I'm actually forcing a little bit into the sulcus, opening up the sulcus, going interproximal there. Okay. All right, same thing. Let's come along this central here. And like I said, this is an ideal material for this type of case. In other words, where we need some retraction, we don't have buried margins. I mean, if you have buried subgingival margins, many times cord doesn't even work, and that's when we'll go to some sort of surgical means, either electrosurge, crown lengthening, or maybe a laser. And this is exactly what we're looking for. We're looking for this material to go into the sulcus, support that labial soft tissue or in that interproximal. And let's take a look on the palate here. Now these two teeth, the two incisors here, central incisors, I'm going to want to go a little bit into these regions right here, because we're doing really what I said would be a minimal crown preparation, or what we used to think of as sort of a jacket preparation. So we're going to cover up the lingual here because we need to get a little bit of function right here. So just opening up that sulcus there a little bit. Everywhere else we don't need it. One of the nice things that I found about working with this material, if for some reason you need to go check a patient, you were away for 2 minutes, it's not a problem leaving this material. It's not going to cause trauma if we have to leave it in for a few extra minutes. Now I'm going to go ahead and rinse just a little bit here. I'm going to wet these cotton rolls. One of the things we found out, we know if the cotton roll is too dry, it can stick to the cheek on the inside, tear the epithelium. Okay, so let's go. We're going to use lots of water here. And it's going to take a good 15-20 seconds to get all of this material out, which is fine. The same as we did with the dual cord technique. We're going to, after we've rinsed, reasonably dry the teeth. So we've just retrieved from the patient's mouth our second impression that we use with the Expasyl technique, used as the second layer of cord. You can see that we've got material subgingival here, and we can see very nice detail. I'm going to try to rotate this a little bit, and really excellent detail. So we could have used this really as our primary impression and primary technique, and so I have no reservations recommending this, especially for a veneer case.